Boom, right on time.
Hey,
Hey, friend.
what's up?
Good work, Tona. Let me turn this down. Where's the baby?
He is in the back napping, so we're getting ready to talk justice, and
You
then
timed it
I'm sure
well.
just in time the baby's gonna wake up.
How about that? Let me put this down
I
real quick.
know. So
Uh,
yes, I'm super excited to be doing this today. My goodness, thank you so much for coming on. I know you're super busy,
no, of course.
especially especially during this time because there's just so much happening around issues of Black justice, and with the Black Lives Matter movement kind of really kind of coming out in full force against police brutality, which I think is amazing. That people are hitting the streets and making their voices heard around this issue, and that they're really kind of pushing and forcing their white allies to really also speak up and speak in their communities, start conversations in their communities, and really take action. So, this is definitely, I know, a super busy time for you.
No, but it's
So,
important. In particular because Kelly, so for folks who don't know, both Alicia and I engage regularly in these kinds of discussions.
yes.
Alicia and I went to undergrad together. We are Columbia Lions. We have been friends for a while.
Lions.
And Alicia is also a doctor. She's a medical doctor. She's a practicing physician. And she has dedicated a tremendous amount of time, both time on the clock and off the clock, raising awareness around, highlighting the need for us all to be better aware of the challenges that Black women and girls face regarding maternal health and reproductive justice. And so acknowledging that, as I have been posting a lot today, that reproductive justice is social justice, we decided
Absolutely.
important to have this conversation. So we both have questions for each other, but I wanted, as people were coming in, it's still only 2:03. Look, people are here for this
I know. They're
conversation.
like, what? We here for
Uh,
this.
I don't know, and I don't know. You can't see my shirt either, but I got on my shirt today too. That's on
Oh,
thing. It
what
says
does your shirt say?
"Fuck it up, sis." It's a
Oh,
it's a protest shirt that I got from Philadelphia Printwork. Shout out to Black
okay.
women who do
Well,
awesome things.
I should show my shirt too.
Let's
It's
see.
Lend. Lend is an organization that I'm a board member of. It's Lend stands for Let's End Neonatal Death. So it's also an advocacy organization that really hopes to bring awareness to Black maternal mortality and morbidity during during pregnancy. So it's
Yeah,
also in its fledgling months, but we're trying to do some really good work, which
Lynn
is
Ellen.
also
What's the
amazing.
website?
So it's lendnow.com.
That's all we're gonna figure it out. It's either
Lendnow.com.
.com or .org. Okay, this
I
is
think it's
important.
that.
And don't say fledgling, friends. Say burgeoning, because we are in a. I just saw my CEO and board chair, Sharon Lemon Hicks, has joined us.
Uh-huh.
She and I have been having a lot of conversations about how the ancestors have been conspiring for our success, and we
Uh-huh.
are in a very different time, right? Just think about.
Yes.
I don't know if you remember Marcus, who went to school with us as well, Dr. Marcus Anthony Hunter, who is a professor at USC.
Mm-hmm.
He and I were talking this morning about the number of white folks. You mentioned this, right? White folks who have been compelled to sort of join us. I have
Mm-hmm.
been affirmed by the number of white folks who I have seen put their bodies on the line. Literally, white folks at protests saying, "Get between the police and Black folks," as a way of signaling that we're in this place of shift. And so my hope is that by doing things like this and highlighting Lynn, that other people will find ways to support your
Yeah,
work. So don't say
absolutely.
fledgling, don't say fledgling
Yes, you're
anymore.
absolutely right. Bushnik.
This is
Not to be
burgeoning, yes.
confused with bourgeois or
I mean,
bougie.
whole nother conversation. Leisha, let me ask you this to get us started.
Okay, let's get started.
I posted something on my Instagram today
Mm-hmm.
that I found in part by just doing some research. Shout out to Song um, uh, for their definition of reproductive justice. But the thing that I
The
wrote
sister
was
song?
um, Song Southerners on New Ground, an
Oh, okay.
advocacy organization that is really led by Black queer women.
Mm-hmm.
Actually, interesting enough, founding Connection and Mandy Carter, a Black woman who was also responsible for helping to establish a foundation upon which NBJC stands. But they do an incredible amount of work all throughout the country, but again, intentionally anchored in connecting Black queer women and people in the South.
Mm-hmm.
And so they do a lot of this stuff. So I found two things. Their definition, song
Mm-hmm.
definition, sister song, is the
Yes.
human right to maintain personal bodily autonomy, have
Yes,
children,
ma'am.
not have children, and
Yes,
parent
sir.
the children we have in safe and sustainable communities, right? So that is the goal.
Yes, that is the goal.
That is, it's aspirational at present because I also read that nothing protects Black women from dying in
Mm-hmm.
pregnancy and childbirth, not education, not income,
No.
not even being an expert on racial disparities in healthcare.
Yeah.
And
Not
so
even being a doctor.
so let's talk about that as a Black woman who is a physician who is also a mom.
Yeah.
How does this and I'm asking this as a Black feminist, right? Somebody who will never be able to enjoy what it means, the joy and the pain, to be clear, of childbirth. But for
Mhm.
those of us who just don't know, help us to understand what this is like in the lives of Black women.
Yeah, I mean, it's this issue is just super important because it really this theme the theme of reproductive justice runs parallel to all themes in the life of a Black woman, right? So not only does it encompass her being able to have complete and total autonomy over her own body, right? Which, as you mentioned, being able to, whether she has children, chooses not to have children, and also being able to raise her children in a safe community and in a safe space, right? Like those are all super, super important things. So as you can see, that kind of incorporates her family, it incorporates parentage, it incorporates her community. And in addition to that, it incorporates other aspects of what we call social determinants of health, which are societal issues that can affect a person's health outcomes, right? So that includes her access to healthy food for her and her family and her children. That includes her access to a living wage, which is super important.
Yeah,
It also includes her access to education, and the United Nations, in their Declaration of Human Rights, has put forth how, as one of their top priorities, that actually protecting the human rights of women is what really propels countries forward, societies forward to advance them. So it's just super important. I'm sorry, y'all know
I'm
I live in
smiling and
Harlem, so it's
acknowledging
gonna be woo
both of us.
woo all the
So
time.
what most people outside of our friends don't know is that we live in the same building in
Yes, we
Harlem,
do.
and so it's usually crazy. But now that you have both of us also being near a hospital, all of these social determinants of health are happening in real time. And so even with like both of our windows closed, you're gonna hear ambulance. You're
Woo
gonna hear it,
woo
right? This
all
is
the
just where
time.
we are. So I was smiling, acknowledging that. Keep going, Fred. Keep going.
Yes. So, all of that is it's just super important to recognize that, the health of a woman is really the health of her entire community, right? So all of that's just super important to understand first and
Yeah,
foremost.
yeah,
Um, to really understand the experience of a Black woman in the healthcare system is quite complex, but I'll try to simplify it by really just kind of looking at this through three lenses, right? So there's the systemic lens, which is what we're really talking about when the Black Lives Matter movement is really speaking about systems, right? How these
right,
systems are inherently racist and inherently treat people unequally, right? And
right,
also the distribution of resources is inequitable as well, right? And that leads to disproportionate outcomes, right? And so it's the same thing with healthcare, right? Where the systems are really designed separate but definitely unequal, right? Like our healthcare system is a fee-for-service system, which means it's based on a capitalist model, right? Anything that's based on a capitalist model is inherently unequal because the resources are not going to be allocated in an equitable fashion among individuals, right? Which, in my opinion, is a violation of our human rights, right? Because health is not a commodity, right? Health is a human right. So that's like super important to understand that our fee-for-service system really separates individuals based on their income, based on their insurance status, and that inherently affects their access, which is a reproductive justice issue. If women cannot have access to quality health care that is patient-centered, and I'll get to what that means in a minute, that is a justice issue, right? So that's super, super important to understand. Also, healthcare is inherently patriarchal and inherently racist, just purely based on the fact that, in terms of medical bias, it's something that's also ingrained in the history with medical experimentation.
connection
Mm-hmm.
a week. Um, I'm missing one thing. To right after you talk about patient access,
Uh-oh. Uh-oh. Okay, I got you
right
back.
here to Teddy Riley.
Hello?
Alisha, you still there?
Yes, I'm here. Can you hear me?
I can't see you in this moment, but I can hear. Okay, it looks like we're back on it now. Okay, so
All
you just got
right.
to back up
Boom.
and go back to you were mentioning that health is a human right. It's not a commodity, and highlighting the ways that capitalism informs racism.
Right, absolutely, because the outcomes between individuals are very, very clear along racial, ethnic, and socioeconomic lines, right? We know that people who are Black, who are poor, who are of color, who are concentrated in certain communities that are largely food deserts and resource poor, resources depleted, are those people that are going to have the worst outcomes in the healthcare system, and that is by design, right? Inherently, because the system is designed the way it is, right? You have just in New York City, one of the richest counties in the United States, Manhattan, New York County, which is basically juxtaposed against one of the poorest in the Bronx, right? Like all you have to do is cross a bridge. So this is really a major issue, you know, when you're talking about access, right? So that's kind of where the system comes into play, is that
Okay,
it inherently distributes resources based on those lines, right?
right,
And
right,
then you
right.
have the perspective of the doctors, right? So you
Okay, say
have,
more about that.
yeah, where it's, you know, doctoring is an art and a science, right? So there is obviously a lot of medical knowledge and evidence that we use to inform the care of patients, but a lot of it is also a gestalt, okay? Because every individual is different. And so what you may recommend to one person is not what you may recommend to someone else, purely based on your experience with that particular health condition and also each woman's individual experience in her body, right? But if I'm a doctor and I don't understand the experience that a Black woman has in her own body, nor do I care, right? If I'm someone who carries with me those stereotypes and racial biases that have been passed down from generation to generation about Black women being welfare queens, Black women being able to tolerate pain at higher levels, Black women, you know, being able to strong Black women who never complains about anything, and when she does is just being whiny, then in my perspective, they're not really kind of even worthy of really having a real thorough honest assessment, right? So that's a huge issue. You know, medical bias and physician bias is a really implicit bias is a huge problem, right? And that's one of the ways that racism is perpetuated within healthcare. And then there's the issue of the woman herself, what she
Wait,
experiences.
before you move
Uh-huh.
on, because
Uh-huh.
it is significant for us to be having this conversation with a Black woman who has experienced the healthcare system, but who is also a practitioner.
Yes.
I want to stay in the space a little bit longer. Is there
Mm-hmm.
anything in your training or the training of physicians at present that is designed to address the transmission of biases or to acknowledge that that happens? I
Mm-hmm.
imagine I know the answer to this question, but does that show up at all in the training? Are there
It did
places
not
for
show
these
up in my
conversations?
medical school training. It did not. And I trained in Baltimore, Maryland, at the University of Maryland, which is a public hospital. It's right in the heart of Baltimore, which, as you know, is a city that's, you know, primarily people of color, and most of the doctors practitioners there are white, right? So, and this is also by design, right? You have a lot of these academic institutions that are located in communities of color, primarily because the community itself is a prime ground for learning. You see a lot more
Yeah.
pathology there because people tend to present to medical care at more advanced stages. So, you know, for a student, it's a lot more interesting, right? Like, which is, you know,
Pathology, for those who don't know the term, means what?
what did you say?
Pathology, for those
Oh, pathology just basically means like someone who has a specific disease, right? Like, or something wrong with them that you're more likely to see when it, you know, presents at a very, very advanced stage versus, you know, someone who has health insurance already who can see their doctor whenever they want to, right?
yeah, yeah.
So for a student and also for a medical school, it's a great place to be, right? And this is also something that is historically based, right? You know, ever since the time of slavery, when they actually started to establish these medical schools, you know, Black women in particular were subjects of experimentation, gynecological experimentation. A lot of the you know, procedures that we have, gynecological surgeries, those were all pioneered by, you know, white OBGYNs who experimented on Black women. So that, you know, going back to the experience of Black women themselves, that mistrust exists very deeply, very deep seated. within us and within our communities that, really make it much more difficult for us to engage with the healthcare system in a meaningful way. So it just, with all of these barriers here, in addition to the fact that the Black woman often doesn't feel heard, doesn't feel respected in her body when she interacts with healthcare, and is often dismissed, is just really unfortunate. And I can
You
give
were
some
going to go there,
examples of
yeah.
that.
Please, I would, yeah, appreciate it. Yeah, you were going to go there next anyway. And I know that a
Yeah.
lot of people, it was their first time thinking about this if they're not having the experience of being in a Black woman's body, cis or trans. I know at some point in the conversation we're going to talk about that as well. But
Mm-hmm.
I hold on to not only my own experiences with friends like you and Lindsay and Kelly and my sister, but a lot
Mm-hmm.
of people only began to think about this when Serena Williams announced how difficult it was for her to deliver her beautiful baby Olympia, right? Also, shout out to them, and what her husband
And can
announced
you
recently with
imagine if
Reddit
it's
is
Serena Williams
amazing.
and you gotta scream to the
A
sky,
literal superwoman, right?
listen
And
to
again,
me?
I'm even thinking about how often I talk about her as the greatest athlete, not one of, but the greatest athlete that our generation has known. So
Yes.
much of that is also imbued with her being seen as a superhero. But again, Black women are women, right? Black girls
Right.
who have the ability to grow into women are still human, are still deserving of the kind of care and compassion that too
Mm-hmm.
often Black folks don't get, right? That's why I talk as much about Teach the Baby. So all this to say, please help to humanize the experiences of Black women that are often dismissed or ignored.
Yeah, I think, I can just give one story. So I had a patient who came into our clinic, and she's somebody who, I'm relatively new to the current healthcare system that I work in. So, but I'm not new to working in this community. So, I'm very familiar, and I'm a Black woman. So obviously, Lou walking to
You
the
know
clinic,
things.
I'm like, where's that? Like
Right,
I'm
right.
just very free with myself, and I think that they very much appreciate that. But there was a woman who came in, and she was, a bit, initially very rude to, well, that's what people told me before she saw me. Oh, she's rude, she's nasty, she got smart with the girls at the front desk, she,
Sassy.
X, Y,
She's
and Z. She got
sassy.
attitude problem. I was like, okay, ladies, let me just see her and see what the deal
Right.
is. Before we like pass judgment on this woman, we don't really know what her experience has been with healthcare. And sure enough, after I talked to her, she was telling me these awful stories about her experience with doctors and how they don't listen to her. How after she delivered her baby, she was severely anemic, and didn't even have follow-up appointments with her gynecologist. Was trying to see someone, but like she felt like it was purposeful that there was no follow-up, or that no one wanted to see her. She's been to the clinic several times and just felt super disrespected. Nothing was explained to her, and so she has this very hardened attitude towards healthcare. Whenever she comes to the doctor, she hates coming to the doctor for that reason, because she just knows
Understandable.
that it's going to be an awful experience for her. So after we talked about that, I was like, she was actually smiling and calm and just really happy that this experience wasn't going to be like that, because before we even got into that conversation, she was a little standoffish with me, but I was like, hey sis, I'm on your side, let's talk about this first before we even talk about what you're here for. Let's talk about why it is that you're upset, or what is it that I need to understand about your experience in healthcare
Yeah.
first.
Yeah.
And often those questions are asked.
Yeah. I was gonna like what is it that I need to understand about your experience?
Mm-hmm.
Pause is a powerful statement that is seldom asked of Black folks, right? So even in
Mm-hmm.
this moment of so many well-meaning white people and asleep Black folks who are tripping over themselves to take up space to deal with their own feelings,
Mm-hmm.
right? Like asking that question to seek to understand is foundational, and I think it's often missed, right? Like
Right.
I'm even surprised that cis kept showing up, right? I think often about conversations I have with Black queer people who are like, I spend so much of my life dealing with different forms of violence. The last thing I'm going to do is volunteer myself up for that kind of experience. So if it means like I don't go to the doctor, then fuck it, I'm
Yeah.
just not going to the doctor. And so
Yeah.
I'm even surprised that after no one having asked her that, she continued to show up and put her body on the line and risk being traumatized or victimized in some way because maybe she knew that she needed it, right? Maybe
Yeah.
it wasn't, she didn't have an option.
She didn't have an option. I'm a family practice doctor, which means I literally see everyone from birth to like 99, 100 years old. And I've always been super proud of that. Like anybody who walks into the clinic, I can see you, and we're all one big happy family. Great.
Yeah.
However, over the last year or so, my practice is slowly kind of, I don't even want to say slowly, I would say quickly has evolved into a gynecological practice. And, I started asking the women who come in, like, how did you hear about me? I'm just curious because, I really see everyone. So it's just interesting how like certain individuals, women of color who are young and in the reproductive age are flocking to my clinic, which is like
Yeah.
kind of in the cut in the Bronx, and like it's not like on a
We're gonna
main
find some
strip or
stuff.
anything. It's
But
like,
again, the
okay,
fuck to
how
the
did you find
capitalism.
me?
When there are things that don't exist for us and there's something that is, we're going to find it. Word of mouth is going to let people know, if you need help, go this way.
Well,
Right? It
yeah,
happens in
but it's
school.
it's
Yeah.
the fact that many of these women have had traumatic experience, like
Yeah.
that in their accessing healthcare, particularly as it revolves around reproductive health, that has been so traumatic for them. We often forget that it's the healthcare system that traumatizes women in a way, in a fashion where it affects their entire sexual health,
Yeah.
right? So hearing these stories of these women, in terms of the examination, which is a very, very sensitive topic for people, nothing being explained to them, touching very intimate parts without explaining, or when women express discomfort or pain and it's kind of disregarded. Not even necessarily just helping someone off the table, like giving a hand, like, let me help you up so you can sit up, let me not just leave you here laying down, like exposed, you know what I mean? Which happened to me in my OB's office, and I'm a doctor, and I ain't even gonna use cuss words on this.
We
You know
grow.
me, I have the pottiest mouth, but this BI literally, when I was 37 weeks pregnant, left me on the table after she examined me, nothing covering me, legs open, and left the room. I said, hold up, bitch. No, you didn't.
Wow. And you are a doctor. She knew you were a doctor.
I'm like, wow, this is crazy.
And your response was what?
She just left the room. I didn't even get a
You didn't have a chance to respond. She was gone.
Okay, so I did get a chance to talk to her after my delivery. So I was at a group that was 4 doctors, right?
Okay.
So this doctor who I saw, she was the one I hated. I did not, her and I did not see eye to eye. And I was just praying that when I went into labor, I did not
That she
get
wasn't gonna be
her,
around. Now
right?
wait, were you at a practice for doctors because doctors make the worst patients?
I am not a great patient, only because
I don't
I
know
don't
any
trust.
doctor. You, Elodie, Miranda, every doctor I know and
I
consider a
don't
friend
trust.
is clear like, I'm not a good patient.
The
It's the part
medical
because y'all are
mistrust is
controlling. Yeah.
real.
Wow. Even as physicians, because you know what's good. We're laughing about it, but this is scary.
No, it's really scary. It's really not, which is why I always advocate for people to go into their doctor's office with someone. But
Mm.
yeah, so I was just praying when I went into labor, please don't let me have this lady. Her and I are going to have
Well,
a
wait, and here's my
problem.
thing. Like, and again, we think about again. All of my male privilege, right? Like, to the extent that I think about labor, what I know is that the the goal should be to minimize stress.
Hmm.
I cannot imagine you. I think 2 things. One is I'm acknowledging that there's a part of this that you couldn't control even as a physician, right? Like,
Right.
it sounds like you could not say, I don't want her to be involved in any of
No, I
this.
couldn't.
And so you had to carry the anxiety of whether or not she could be there with you to and through your delivery.
Yeah, but I had a doula though, and so I wasn't playing those games. And my doula, for anybody who's looking, like, what questions you need to ask a doula, number one question: can you speak up for me?
Okay.
Do you feel comfortable pushing back against healthcare decisions that are being made on my behalf if I don't agree with them? Do you feel comfortable communicating with doctors in a way that's a bit forward and may be perceived as, and you might get pushed back yourself and it might not be nice? Are you going to be good with that?
Yeah.
My doula is about it. She's like, oh yeah, I already know it. I'm like, great. So
Okay.
this is, and this happens to be someone I've known for a very long time. Like we went to high school together. So
Okay.
there was already the trust there. So I knew
So
she
it
was going to
sounds like
represent.
that one of the big roles of a doula is a patient rep or advocate, which is important, right?
Absolutely.
What are the
Absolutely.
other benefits of a doula, or why would you advocate or recommend a doula for with black women in particular?
Yeah, Black women should definitely have a doula. So doulas have many roles. So there's generally doulas who are like birth doulas who are there, during the pregnancy to support you, and also there during the labor, the entire labor. And then you have
Okay.
like postpartum doulas who really help with the breastfeeding and
Uh,
caring for the infant and really making sure that the mom and also the father, can get back on their feet. They're also
our
really good with,
parents,
yeah,
our moms.
the parents. Yes,
Yep,
absolutely.
yep,
So be
yep.
inclusive in the language.
Yes.
Apologize for that.
No, we
So they
learning and
just have
growing.
a
Yep.
super supportive role. They provide education. They provide support. They can advocate on your behalf with healthcare. They can explain certain tests. They can explain decisions
Okay.
that are being made for you by the doctor. So they're just somebody who's just a great resource. In addition to that, they're there to labor you, right? So when you're there in the hospital, they can help you to labor. So you're not being labored by a bunch of strangers. You know this person, they know you, they know what you want, what you desire. And so, you have the nurse, because usually the labor happens with a nurse and that's it, right? And then with the partner and that's it, right? And the partners, they're helpful. They are, but sometimes they don't really know what to do. So
Right.
really it's the nurse. And this person may or may not be having a bad day, So you really want
Yeah.
somebody who's going to be your advocate. It's just, and in addition to that, there's so much research out there in the medical literature about how doulas improve outcomes, reduced morbidity, which means disease related to pregnancy and also childbirth, reduced death, reduced use of Pitocin, which is the labor inducing drug, because there's like more relaxation, less anxiety. So, and that piece is really important for allowing your body to do its work. You must be relaxed. You
Mm.
must kind of let go and your body do its thing. Um, yeah, they're great. I mean,
What
yeah.
other resources exist like doulas for Black women who face, it seems, both incredible and seemingly insurmountable obstacles within the medical industrial complex?
Well, that's the thing, right? Like you have organizations, which you mentioned, the Sister Song. There's also Ancient Song, but these are doula organizations. A lot of this reproductive justice work is really spearheaded by doulas themselves because, they are really on the front lines of this issue, right? And this is why I feel like it's something that's super important for me to kind of bring to the forefront as a doctor because, not many physicians are really speaking about it. I think now that we're kind of in an era where justice is kind of moving to the forefront of the conversation, hopefully more doctors will start to speak up about this, about the implicit bias that they witness and, and holding people accountable, right? So, yeah, it's just super important, I feel, for us to really speak up.
Are there ways for non-physicians to do the work of holding physicians accountable? Like, what can I, as a Black man, do to contribute to this work other than, in addition to, rather, not other than, in addition to trying to find ways to directly support Black women and girls?
Well, I think, the reproductive justice issue is social justice, as you mentioned, right? So when we speak about social justice and justice for people of color, we should definitely not forget to speak about women. I
Yeah,
think oftentimes the conversation is focused on, issues of police brutality, which is super important, and the criminal justice system. But we have to remember that justice really crosses all aspects of our lives, right? And that,
yeah,
again, as I mentioned, when you leave women out of the conversation, you're basically leaving the entire. I mean, I don't think that we're really truly going to be able to make steps forward without, actively including us in this conversation, right? So yeah, it's just super important to just keep in mind, and bring that to light when we're speaking about these issues. That the issue of justice is also an issue, a women's issue too.
yeah, yeah.
Yeah.
No, I honor that. We mentioned it earlier, and I want to make sure that if you have questions, we're able to hold space for them as well. And then I'll scroll through some of the comments to see if others have brought things up. Excuse me, not a Corona call. Um, I do
You
wonder.
know we're supposed to be social distancing.
Listen, right? I know I'm here by myself. Um, I do wonder how we make space for the diversity of experiences with regard to womanhood or womanness, and how individuals come into that. And so I don't know if there's a question beyond just wanting to name that reproductive justice impacts women, both cis and trans, Black women, cis
Yes,
and trans,
yes,
in different
yes.
ways. And I'm conscious of the need for us to name that.
Yeah, absolutely. It's just super important for us to share our experiences. I think that, you know, we as women of color, at least, you know, as a Black woman in my family, and I know that this is for many other families as well, that, you know, speaking about issues of health are often very private issues that are not shared. And that kind of, you know, idea or mentality around, oh, I have to hold this myself. Like I have to
Yeah,
hold my trauma with healthcare in my own body. Like I can't share that with others. It's definitely a fallacy, because that means that, you know, other women suffer just like me. You know, for me not to say that I'm not also the victim of implicit bias and racism, and I'm a physician, and I
yeah,
call that joint out at the start. I'm like, look,
yeah.
you don't know me, but this is what you need to know about me, if nothing else, because I'm not
Right.
here for the shenanigans. I'm just
Right,
not.
right,
But still, you know, it's just important for us to share our stories. Like we need to hear each other's stories. We need to hold each other's pain, hold each other's hand, and support one another. We need to
yeah.
share
Most definitely.
resources, and there are a lot of resources about for doulas that volunteer their time as well for women who can't necessarily afford to pay for doulas, because in
How do
many
you find
cases they're
them? How do
not
you find
covered.
those?
I can actually connect you with, there is a few doula collectives in New York City that provide services like that for low income women.
Awesome. I'll commit to sharing it in a series of posts, both here and in BJC on the Move. And as we continue to engage in this work, we'll ensure that if people reach out to us, we're happy to connect you to that network and that resource.
Yes, absolutely.
Yeah,
But yes, we
I
have
love
to
that.
share that. I mean, it's just super important, you know, for us to, you know, kind of collectively heal from this reproductive trauma that has been inflicted upon ourselves, on our mothers, on our grandmothers, going all the way back to the time where our ancestors were being experimented on,
Yeah.
as, you know, sexual violence perpetuated against them. Um, so that we can start to heal from that, move forward, and share resources. And I would always recommend people
Ah.
bring someone with them to the doctor.
And in practice, you brought Lynn to the group with you because they tapped in and said Compassionate Doulas
Yes.
LLC is an amazing doula company in the Baltimore area. And so this is just an acknowledgement that it sounds like they are located, as Black women are, right? We don't deserve Black women. They're located in the communities where they should be. And so we'll do
Yes.
some additional work in order to make that happen. Um, Kelly talked about a lot of this is even harder now with COVID
Hmm.
and sort of visitor companion restrictions. So just acknowledging that it's harder to think about having an advocate with mothers now as they deal with.
Absolutely. Yeah.
Yeah, I didn't think about that as well. So the two things, and then I will try and refrain from asking you more questions. A lot of people just saying that they love and appreciate you showing up as
Thank
a
you
Black
all for
woman and as a
showing up.
physician. Is one, how is COVID both complicating things and maybe possibly disrupting things such that we can shift in a more in a radically inclusive direction? That's one question. And the other is, you and I have even talked about this as it relates to Jordan. I talk very publicly about my 16-year-old niece, 16 going on
Hmm.
31. And I, for years, at least since she has been 10, she and I have had fairly uncomfortable conversations about sex and sexual wellness and options and HIV and condoms. And
Hmm.
if there's a question is what are the tips, resources, advice for Black folks having more of these conversations, because we still live in so many homes and communities where you don't do it, let alone talk about it.
Yeah. My mom used to tell me, she said, keep your legs closed and your dress down. That was the end of my sex ed conversation. And I was like, oh, okay, sure.
Right, sure, right, right.
Meanwhile,
My
I was
mother
hitting the
not
streets.
See, because it's gonna happen, right? And so that's the hard thing, which is that I said to my mother recently. I said, "Well, is Jordan? I should stop putting her out here like this. She might be mad at me at some point when this
I know,
stuff comes out.
dang, why are you saying her name too?
I love her. I'm sorry. It's a habit, right? I'm sorry, but the point is that it's too late now, right? But I was saying to my mom, is she on? I should stop. Let me stop. I'm gonna honor that the
Yes,
Lord is telling me
please
to
don't
stop.
put her business
It's
in the
not specific to her.
street.
The reality, though, however, is that sometimes we don't have these conversations because we are waiting for something to happen, right? Like,
Yeah.
and not specific to Jordan. I do think that there is a way sometimes that we say we don't need to talk about condoms, we don't need to talk about birth control, we don't need to talk about these things until they are having sex. And I'm like, well, but there's a moment, right,
Hmm.
where one is a virgin and then one is not, or one is and then what isn't, and so we should already be creating the kinds of environment. And my hope was that like we could talk about this stuff. It doesn't have to be shrouded with all this stigma. I,
Right.
I I'm clear that at a certain point, although I want to keep you like close to me, right, that's
Hmm.
not possible. You want to, are entitled to, and should very much feel the kinds of pleasure that come with that. And I want you to do it in the most responsible way possible. Again, that's centering me. You will have to live your life, and I will be here to support you. And I've tried to create again the environment where we can have that conversation. I also know that like I'm her uncle. Sometimes it feels weird. Like
Yeah,
so,
that's weird.
how do we do more? So how do we do it in ways that aren't
I mean,
weird?
I
My
wasn't
heart's in the
talking to
right
my uncle about these
place.
things.
Who were? But you said you weren't talking to anybody about it. So Mama said keep your legs closed and your dress
I
down.
really wasn't. I
So
really wasn't.
how do we? Where's the place in the middle where it's
Well, I
not
was talking
weird?
to one person,
Okay, who
and it
was that?
happened to be the school nurse in my high school.
Okay,
So she was very uniquely positioned, I think, geographically, because she was there in the school. And also, she was just like a very caring, open, non judgmental person that I
woman
knew
of
that I
color,
could go to.
black
No,
woman.
she wasn't.
Oh,
Mm-mm.
interesting. Okay, so this isn't about race in that regard. She was competent and compassionate.
Yes, yes,
Okay.
very competent, very compassionate, and she always would just sit and listen and support and just try to,
Sit and
encourage me and
listen.
push me in the right direction. Yeah.
I
So it
heard you
doesn't
say sit and listen. That's step number one.
super. I mean, because and sometimes with teenagers, they don't. They're kind of sometimes a little awkward in terms
A
of having
little,
conversations.
a little.
So you have to sit and let them speak and give them a space to talk because if you overtalk them, they're not going to talk.
Now they're gonna shut down and not
Yeah,
answer the phone.
yeah, exactly. So,
Okay.
so to
What's
answer
going
your
on with COVID?
Yeah,
Yeah.
COVID. So COVID has really changed everything, my goodness, in terms of healthcare. I think in particular, as it relates to seeing patients in person, a lot of these visits have been converted into telehealth visits that are happening via video and also through the telephone. And this is even happening in OBGYN offices too for pregnant women. And, this has been a blessing in some respects because it's, really kind of allowed people to stay in their homes and stay safe. And it's really was a necessity that was born out of just the pure infectiousness. COVID is
Yeah.
just highly infectious of the nature of the virus and also the fact that pregnant women are inherently immunosuppressed. So we really didn't know how that was going to play out. We know that people who have weaker immune systems, like pregnant women, were suffering at disproportionate rates from complications from COVID. So really just trying to keep them safe. The problem with that, though, is that you can easily miss things, right? You can easily
Mm,
misinterpret things.
if
As
if if people don't have the benefit of coming in regularly and checking up and all of that.
Right, because when you come
Okay.
in, you're checking someone's blood pressure, you're checking, their weight, you're checking all of these other things that you're just not going to be able to check. You're checking for the baby's heart rate, checking for heartbeat, things like that. You're checking for any pain, all of those things. And you're also doing other laboratory measures like checking her urine to check to make sure that that's good. So for lower risk women, obviously, the thought was that, well, we don't really need to have them come in as the risk benefit ratio is that if they stay home, perhaps we would expose them less. Um, but there was a young woman who actually in the Bronx who recently passed away. Her name was Amber Rose can't remember her last name,
I'll
but she
look it up.
recently,
Amber Rose,
yeah, and
not to be
her,
confused with
I was
Kanye's
recently on a
ex.
panel with, yeah, no, definitely not. I was recently on a panel with her husband who was telling the story and advocating for their organization, the Save a Rose Foundation, that was started in her honor, in honor of her death. But again, someone who, you know, this, you know, was the victim of medical neglect because these telehealth visits and, you know, there were things that were missed, unfortunately, and she passed away from HELP syndrome, which is also what I had during my pregnancy. It's very scary.
Mm.
Um, so, which is a syndrome of preeclampsia. So
Say the
yeah,
name of the symptom again, and then help me understand what preeclampsia is.
so HELP syndrome is basically a syndrome
H E
where
L P
HELLP.
L L
So
P. Okay.
preeclampsia is basically it's a condition that pregnant women get where it becomes like a vascular disease where all of the blood vessels in your body become extremely leaky, and you get this whole syndromic, you know, you things that happen all over your body to all of your vital organs, including your kidneys, livers, inflammation in your liver, your blood counts start to drop. It's just kind of like this massive inflammation in your body that can lead to seizures and death, and
Okay.
also high blood pressure. And it's something that's far more common among women of color. So that's the other thing that's part of the reproductive justice is really speaking about these issues that affect women of color disproportionately so that we can uh, bring awareness to this issue. Um, but
Wait, Alisha, I'm struggling for a second. I'm sorry. So I just heard you say that there's something that we expect to happen generally in women, and we know it happens more so in Black women, and it sounds like it affects your entire body based
yeah,
on the system that delivers blood and oxygen to our bodies. It
well,
affects that.
it really comes from the placenta. We don't know when or how it's going to start. It disproportionately affects Black women, and it can be very, 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 very deadly. Generally, the cure for it is you have to deliver your baby, no matter how early that is. So it could be pretty scary.
This
I
is a
think,
this yeah.
yeah,
I'm sorry. Let me let you finish. You
it's
said it could
okay.
be pretty scary.
Yeah, it can be. I mean, mine developed in my labor when I was already at the hospital. So, but I had noticed that I was gaining a lot of weight like 2 weeks before that. I had gained 5 pounds in 1 week, which I thought was weird. I had been gaining one pound a week. And I told the doctor that. I was like, it seems odd. Like 5 pounds is a lot. But then I was like, oh, maybe I just ate some salty pho. You know, this pho is salty. I shouldn't have had it. I was a gestational diabetic too, so I shouldn't have had the rice noodles. So I was attributing it to that, you know, because you often like in your mind as a patient, you're like, well, I could have done something differently. Like
Yeah.
we always could have, you know. But no, it was preeclampsia, and I should have. I mean, I'm not. I promised myself I was not going to doctor myself, so I trusted. And she's like, well, you know, we'll just keep an eye on it, kind of thing.
That's a lot of trust. I'm thinking in this moment, there's a podcast called Dissect. It takes long form music, so it took Lauryn Hill's Miseducation and broke down the songs and what was going on in the world when she created them, and the different lots of different elements. And there's a point where they get to Zion, right, which is Lauren's ode to her baby and her
Mm-hmm.
working through the world, telling her not to deliver this baby. And there's a commentator on the podcast episode that says that Black women and their bodies are so controlled and often under attack in such a way that any way that they deliver a child into this world is a miracle worth celebrating.
Mm-hmm.
And I remember hearing it and having to pull over because it broke me. My sister was pregnant at the time with the twins, Jet and Jax. And it was a reminder to me that like there are these things that happen that we've accepted that we don't even talk about. Like it is literally like you offer yourself up for the potential of death to bring life into the world, and and there are things about it that are specific to race. And I don't know that I even in this moment have the words to explain how that makes my body feel processing that right now.
Mm-hmm. Yeah, and we don't really know. I mean, we know that there's a theory called weathering, right? Which is where because we don't really know a lot about preeclampsia, like why this happens. We know how it happens, but we don't really know why it happens. But there's a theory that's called weathering, which is that Black women have experienced so much generational sexual gynecological trauma that it has,
Mm.
in effect, changed our genetics, such that when there are
Mm.
certain processes that our body goes through, um, these genetics, this adverse genetic reaction manifests. So, and they actually show that, there's a shortening of the DNA strands and a fraying at the ends of the DNA strands, and they call that weathering.
Mm.
So yeah, but there's still so much work to be done around understanding why it is that Black women disproportionately have this issue.
So what do we do now? There was a sister, someone in the comments who earlier said after we have our babies, they don't care about our blood
Oh,
pressure
tip,
rising.
tip,
They
tip,
just
tip
send us on our
77.
way.
That's
That's
my
exactly who
sister.
said that.
Yes, it's
Somebody else talked about it. Just feels like they just don't care about us. So what do we do, Fran?
yeah. I mean,
Oh,
definitely.
somebody said too. Subversive Smurf said yes, that happened to me. I never go to the doctor.
Yeah, yeah. I mean, this is not like a isolated thing. Like literally, I would say like 80% of the women, Black women I know, have bad experiences, and it's not just a one-time thing. It's like happens all
Mm.
the time. So it's like really bad. Yeah, like Tip 77 said, after they have our babies, they don't care about our blood pressure rising. I mean, I know that happened to her where, I had preeclampsia. My sister, was concerned about her blood pressure, and her doctor basically disregarded her. After I just told you that it could be deadly, and it can
Right.
also occur postpartum. So it's super important that women are also monitored postpartum for this.
After. Yeah.
Um, Completely blown off. Um, so it's just really important that we kind of start to advocate for ourselves, bring
What
advocates in the
is
community.
eclampsia different than preeclampsia? Oh, that's the name for it after the labor.
No, eclampsia is different from preeclampsia because eclampsia means that a woman actually is at the end stages of preeclampsia, which means that she
Ah,
actually has a life-threatening seizure. So that's what eclampsia means. So in
okay.
addition to this whole syndrome of, having anemia, having low platelets, having severe liver inflammation, having kidney failure, having, low platelets, so you basically can bleed to death, and this is you're having a baby.
A
So it's
seizure while
important
you're
that
having a baby.
your platelets and your clotting factors be normal. And then the seizures are kind of the end stage of that.
What is a seizure?
So a seizure, you really want to break this down, don't
I
you?
mean, I'm here. I got a doctor on. I'm like, yeah, why
I,
not? Because we know. I mean, in part because when I think of a seizure, I think of how it's presented based on Hollywood TV shows and movies, right? We see someone
yeah.
unable to, what seems like unable to control, like something is happening internally, but I really want to know what's happening, what's going on inside.
Yeah. So basically, a seizure is basically like a malfunctioning. So your brain is like this massive electrical circuit, right?
Okay.
And they say that humans only use about 10% of their brains, but children use 50%, 50, 60%, which is why, that critical period between 1 and 6 is so important for child education, exposure, all
Yeah.
of those things. And that's also a
Yeah.
justice issue, right? You can't talk
Yeah.
about
It's why I'm
reproductive
worried
justice
about
without
babies
talking
protesting
about
now. Yeah.
right, without talking
Yeah.
about also infant mortality and also
Yeah.
early childhood education and all these issues that children face in early childhood. You can't
Yeah.
separate the
Social
two, right?
determinants. That's what you said earlier. Social determinants
Yeah.
of health. Yeah.
So basically, your brain is like this massive electrical circuit, and when you have a seizure, basically the circuit malfunctions and overloads, overheats, basically. So
Mm.
with that, your brain is stuck in this loop of electrical activity that causes you to seize, right? Because your
Got it.
brain controls your body, controls your muscles, it controls everything, your consciousness, all of that. So people go unconscious and they start to seize, and you may see the shaking depending on the types of seizures they have. But that's what
Got
it
it.
is. Yeah,
Got
and
it.
that can be life threatening.
Got it. Super helpful. Thank you for that, friend. Someone asked if this conversation be recorded. Yes, I will share it immediately to my page. It'll also be on NBJC on the Move, and I will share with Alisha as well, so that she can share it on her platforms. Subversive Smurf said, "I'm indigenous." That was the comment earlier that I read about I don't go to the doctor. They said I'm indigenous and very suspect of Western medicine with regard to my people. I understand it. I talk a lot now about how people should be clear that these protests are also rooted in white people creating the postal system so that they can steal land from indigenous peoples, let alone try and control our bodies.
Mm-hmm. Yeah, with regards to white people, absolutely.
Yeah.
And it's the thing is, with Western medicine, it's really good at some things, and there's just so many things we get wrong. I mean, it's, in terms of, prevention, maintaining health, we're not so good at that. We're really good at like treating people who have acute diseases, who are acutely ill. We have the technology and the know-how to do that. But in terms of prevention, which is like 90% of what healthcare should be, we're not so good at that. We don't need, and the healthcare system doesn't prioritize that. Insurance companies don't pay for that. They don't pay for you, the 15 minutes that I have with each patient, the code for dietary counseling, that's not reimbursed, right? They want me to put
Mm.
something there like like high blood sugar or diabetes. That's what they're going to pay for. But they're not going to pay for me to do
Preventing
the
somebody from getting
education.
there. Yeah.
Yes. No.
Because the profit is in the pain part of it. It's not in the
Exactly.
prevention.
Yeah. Which is unfortunate. And that's also a justice issue.
It is, and to that point, right as we're having conversations right now about defunding the police
Mm-hmm.
and divesting resources from police who are getting funds that otherwise should be going to social workers and counselors and healers and
Mm-hmm.
doctors,
Yeah.
this is important and appropriate, and I appreciate you continuing to hold me accountable as somebody who is positioned based on the work of MBJC to do better. To
Mm-hmm.
do, I've taken a lot of notes, and I'm going to write our plan, which includes making space and connecting with organizations that do work around reproductive justice for Black lesbians, Black trans women, and gender nonconforming folks, because we can and should be doing more in this regard.
Yes, absolutely. So, how do you feel like this kind of all fits into the overall vision and theme of Black justice?
I think that at least two things. One is I continue to say and have written a lot more since June 1st that all Black lives matter, right? To
Mm-hmm.
be
Right.
clear, not to be confused
Yes.
with all lives don't matter in this moment, right? Um, this is particular in acknowledging the collusion of race and racism and anti-Blackness and white supremacy in this country.
Mm-hmm.
And as it relates to that, right, like all of us are free, all of us cannot be free unless and until all of us are free. And this is about us being holistically able to be in our
Mm-hmm.
bodies and whatever that means at a particular point in time, if we so choose to do whatever with it, right? Like bodily
Right.
autonomy in every way, shape, or form. And in order for that to be real, this has to be addressed.
Mm-hmm.
And so, in particular, what I'm mindful of is that we have a number of partnerships, including with Planned Parenthood.
Mm-hmm.
We can and should be doing more with Sister Song and with Song. I don't want to conflate those two organizations as it might have been interpreted as us having done in the beginning because of me reading that definition. And so, what we will be doing more, especially this summer, is holding space for and connecting with leaders who do this work all the time so that as
Mm-hmm.
we are advocating for policies, not only at the federal level, but in the states where Black queer people are disproportionately concentrated, state in the South in particular, and as we're fighting for things like the Equality Act, that this is very much included.
Mm-hmm. Absolutely.
Yeah,
Great.
I think
That
at a
sounds
minimum
great.
we can be doing that. We can also be highlighting that this is something that affects Black women and girls, both cis and trans. Right, I'm
Mm-hmm.
hyper
Yes.
concerned
Super
that there's a way
important.
that queer possibilities have been typically erased because
Yeah.
there are ways in which we have this conversation that affirms that like to be a woman is to, in theory, be able to reproduce, right?
Right.
And so much of what I like about that definition from Sister Song is that it's about the choice, and
Right.
it's about
And it's about
acknowledging that
access. And it's
it's
about
about
access.
yeah, and it's about appreciating that at its core, reproduction is the anchor. But for me, it's about the experiences one has being and living in their body when engaging with the medical and industrial complex.
Right. Absolutely. This is
And
absolutely correct.
that's at the core of what we do as an organization when we just think about our experiences with all of the public education, the prison
Mm-hmm.
industrial
All of
complex,
these
medical, and
systems.
yeah, so it's very much aligned. And I appreciate you for allowing me to have this teach the babies moments to ask questions, to learn more, so that I can use my privilege, right? My male privilege, my cis privilege, my all of my privileges so that I can be a better active accomplice. I hate the word ally because it's othering if for no other reason. But this is useful for me so that I can be more of an active accomplice.
Awesome. I love it. Well, I appreciate that.
I
And
love
I'm
it too.
super happy to have this platform to speak about reproductive justice as well, because it's super important, just especially in light of what we know about Black maternal disparities in healthcare, with Black women being 4 times more likely to die during their pregnancy or childbirth.
You said 4.
4, yeah. And that's controlled for race, class. I mean, not race, sorry, controlled for class, income status.
Yeah, all the other things that they
All
say
the
level it
things.
out.
Yeah, and it does not. So, yeah, so it's just super important that we start to try to also kind of take control of, there's obviously from a systemic point of view things that can be done, but I think also within our community there's work that we can do as well in terms of raising awareness and sharing resources and providing support to other women who may be experiencing these traumas at the hands of the healthcare system, and to know that they're not alone,
Yeah.
and that it's very common. This is not something that's uncommon at all.
Is there a place where, is there someone who is collecting these stories or otherwise helping to normalize the reality that this is not an isolated experience, that it is a form of systemic oppression, and a
Yes,
way for us to
there's
understand how
actually,
racism is working?
there's actually a few really good books that were written about this issue. There's one in particular that I actually am still actively reading called Reproducing Race. It's basically an ethnography about the racialization of Black women during pregnancy and how the healthcare system perpetuates racial disparity in that sense.
Okay.
It's actually quite powerful. It's
Okay.
about this anthropologist who did her research at a public hospital here in New York City, which she doesn't name because she doesn't want to put them on blast. But I have an idea which
I'm sure you
hospital it
do.
is. Yeah.
Uh,
And just talking
it
about
probably
Black
doesn't matter
women's
because a lot,
experience there.
yes,
Yeah,
it probably
this
doesn't
is
matter the
kind of a
specific
universal
hospital because to
story.
your earlier point, it's probably there are remnants of it in all of these hospitals, right?
Absolutely, absolutely. So, the healthcare system is a system and certainly needs to be changed, right?
Like everything else going on in this country. Kelly says the main thing that is wrong with Western medicine is that it wants to be the only medicine, and as such, it dismisses and attempts to delegitimize all other forms of human care. I appreciate that.
Absolutely.
Of course. And then we got Kelly's comment, and then Lefty's comment right after.
Call them out.
Lefty said, "Call him out." Yeah, you have to. Alisha, what can we do to support you? I'm in this moment. I'm feeling bad. Like you didn't go through all this stuff as a doctor, and as a mama, and I went there, and I'm just what more can we do to support you as you
Yeah,
continue to lead
we
this
can just
support work?
continue to have these conversations. You can share, the information that I post, share
Without
this,
question.
broadcast, for example.
Yeah.
I'm
Yeah.
just getting the word out there about how important this issue really is for all of
Easy.
us, for our communities, right?
Happy to do that. Happy to do
Yeah.
that. And I'm going to connect with you on Monday. Someone on
You
my team
sure?
is gonna,
Don't make
I
me have to
am.
come find you
No, I'm a
upstairs.
scared you like you know where to find me.
Like,
And you can do it in in these COVID
David.
streets, right? I can't even tell the doorman, don't let her up. She live here. No, but there's someone on my staff who cares a lot about these issues. I invited her to join, but it's also the weekend, so I wasn't gonna force her to do it. But we'll connect just to you hold me accountable and our organization accountable for being a better partner.
Cool. And thank you so much for doing this amazing work of justice. You always, wave the flag and carry the banner of justice, even when it's not, popular to do, or it's not on the forefront of people's minds. So I just thank you for doing that. And also just bringing awareness to issues of, queer, LGBTQI, trans folks who, otherwise would not have a voice and a platform, to be their views to be represented. So thank you for that also.
No, thank you. My duty and my honor. This is how I think we pay back the privilege of all of the degrees and other stuff that is supposed to make our lives easier, but have really just allowed us to be better at articulating the systems that need to be destroyed so we can build something that is more equitable in its
Yeah.
place.
Yeah, absolutely. And we're also still, seeking to understand more about these systems as well, and how we can, help to deconstruct them and rebuild them. So it's
Yeah.
also still like an ongoing learning process as well. The more people we talk to, the more stories we hear, the more, so that's all amazing.
Yeah. Yeah. A couple folks are just tuning in. Yes, I will share this immediately. Please follow Happy Healthy Dr. Alisha. Her name should
Follow
be on
me.
one of these
Follow
things
me.
now. Also find
Follow
ways
me.
to support Lind now. as an organization. You can find them on
Yes,
Instagram.
support at
Uh,
Lynn now.
and love on a doula. Look, all of us know we should know doulas. If you don't find a doula, and
Find
love on them.
yes,
Can you be a
please.
male doula?
Absolutely. You
Not that I
absolutely
need
can
to
be a
add
male
something else to my
doula.
to-do list, but I might, yeah, we might circle back on that. All
Yes,
right, good
absolutely.
people. All right, Fred, I'll see you soon. I love you and I thank you for
All
everything
right,
you
love you
do.
too. Thanks everybody for tuning in. Bye
Have
bye.
a good day, everyone.